Welcome to a special hour of MSNBC focused on the coronavirus pandemic. I'm Chris Jansen.
I'm Joshua Johnson. We know you got lots of questions about the outbreak, and we are here to get you some answers. Now, at any moment, we're expecting to hear former Vice President Joe Biden speak about coronavirus. We will bring that to you live. But first, we've gotten thousands of emails and tweets.
Unbelievable, really.
It has been amazing how much you shared with us your questions about this deadly outbreak. We've got an incredible team of experts here to help answer them.
And we don't want you to just stop now. We want you to keep the questions coming throughout the hour. Use the hashtag MSNBC Answers on Facebook, Twitter, and Instagram. You can also email us, talk@msnbc.com. Now, we do need to make one thing clear. Our answers are based on what we know right now about the virus, and that has been changing very fast. Nothing we say can substitute for the advice of your doctor and your specific situation.
One thing we do know, coronavirus does not discriminate.
No.
It is affecting everyone from heads of households to heads of state. Canadian Prime Minister Justin Trudeau just announced that he is self-isolating and working from home. That's because Trudeau's wife is being tested. She started showing symptoms after returning from a speaking engagement in London. Here at home, stocks are plunging again. Investors are concerned both about an economic slowdown and about what the government might do to help. This morning, trading paused for the second time this week. You can see the Dow is trading down just over 5% right now. It's been trading down just minutes after the markets opened. That's when the trading halted for about 15 minutes. Now, today, the House plans to vote on a package of protections. Those could provide free coronavirus testing, paid sick leave, and stronger unemployment insurance.
For now, Congress is continuing to do its work in Washington, D.C., but the U.S. Capitol, along with the House and Senate office buildings, will be closed to the general public for the rest of the month. The impact on vacations and travel continues to grow. Princess Cruises says it will stop operating 18 of its cruise ships for 60 days, affecting trips departing March 12th through May 10th.
And President Trump is banning foreign nationals from entering the U.S. if they visited the European Union. Now, Ireland's prime minister was at the White House today. He said that his country's been doing rigorous border checks. Ireland and the U.K. are exempt from the ban. Now, right now, the U.S. has 1,323 cases and 38 deaths that we know of. That's almost 300 more cases since yesterday. Globally, we're at more than 118,000 known cases and more than 4,000 deaths. Those new cases include Tom Hanks and his wife, Rita Wilson. They both tested positive in Australia.
And the man in charge of the U.S. response, Vice President Mike Pence, can't tell us exactly how many people will be affected.
We know there will be thousands more cases of coronavirus in this country, but well, I'll leave to the experts to make the estimates of how many people may be infected.
Now, before we get to your questions, let's review how we got here. The first coronavirus case was discovered on New Year's Eve in Wuhan, a large industrial city in central China. The red line on this graph represents the number of people infected in China. You see it peak right at the beginning of February and then start to fall off. The blue line is the number of known infections outside of China.
Now, to put this in perspective, yesterday in China, there were only 31 new cases. Everywhere else, more than 4,000 new cases were reported. Joining us now, NBC News medical contributor, Dr. Natalie Azar, NBC News science contributor and virologist, Dr. Joseph Fair, and the chair for the Brookdale Department of Geriatrics and Palliative Medicine at Mount Sinai, Sean Morrison, along with NBC News medical correspondent, Dr. John Torres, who is live at a vaccine lab in Pittsburgh. So much to get to, but I want to start with a big picture question, if I can, Dr. Natalie, because we all have heard by this time that if you have a compromised immune system, you are more likely to be in trouble. Great question from Miss Wendy. What constitutes a compromised immune system? Do autoimmune diseases like lupus, alopecia, MS fall under this?
That's a great question. It's a question I'm getting from my patients since I'm a rheumatologist. But so classically, we think of chronic diseases that could affect your immune system would be chronic hypertension, heart disease, diabetes. Certain people with underlying lung disease are at greater risk for having a complication from a respiratory illness. Patients who are also currently being treated with immunosuppressive medicines, either, for example, for their arthritis, or patients who are on chemo to treat cancer, are obviously also immunocompromised. There is a varying degree of, I would say, innate susceptibility when you have a condition such as lupus or RA, but you're not being treated. We know that there is some altered immunity there, but how much of that is going to play a role in this particular outbreak as opposed to the flu or any other thing, we just don't know yet. So I would say the take home here is that for people who do have underlying autoimmune or inflammatory conditions who are not being treated with medicine, you're going to be even extra vigilant. Work from home if you can. That's the guidance that I'm giving my patients now. If you are on medicines that do suppress the immune system, you're full-blown in that category that you're at greater risk.
We heard from a number of patients actually who are dealing with one malady in particular. Here's what Jess had to ask. Jess asked, I keep hearing that people with diabetes are more at risk. Does this apply to type 1 diabetics as well? I'm a 38-year-old type 1 and my blood sugars are not perfect. Am I more at risk? Type 1 groups have been asking this question by the thousands every day with no answers. First of all, remind us what type 1 diabetes is, and then if we can get an answer to Jess's question.
Oh, you're not going to yeah, so type 1 is generally considered an autoimmune disease. That's usually patients present when they're younger. They tend to be insulin dependent. Their bodies literally don't make insulin. Type 2 diabetes is generally referred to as insulin resistance. It's associated with obesity. That's where your body's making insulin, but you're not responding to it. Or you can't utilize it, I should say. But both conditions are characterized by elevated blood glucose levels that can have, significance in terms of chronic sequela. The specific question of whether or not a type 1 is more or less immunocompromised than a type 2, I'll be completely honest, I'm not sure that I can tell you specifically. What I would say is that poor glucose control in general, since it's associated with so many other consequences, would be the most important thing, not whether or not it's type 1 or type 2. If there's any endocrinologists out there who have a better answer for me, I'm happy to hear it.
Well, let me ask a question that all of us found fascinating, and it really speaks to where we are today, very different. I'm a student, Reggie says, at Loyola Marymount University, but with the coronavirus outbreak and the flood of information, both reliable and non-reliable, I was wondering if young kids, adults who juul, vape, smoke are at the same risk as elderly people for respiratory and other complications from coronavirus.
We got a ton of questions on vaping, by the way.
Lots.
I've started seeing that, and I need to dig deep on that.
Yeah, please.
Oh, no, I mean, not at the moment.
Smoking and vaping equally affect the lungs. I won't say exactly equally, but vaping is smoking to a degree. So you're automatically lowering your immune system and lowering your resilience when you're vaping as well as when you're smoking.
Before we get to the question from Laura, I should also just note that for the purposes of this conversation, I don't know is a perfectly acceptable answer.
Yeah.
And there'll be plenty of questions that we just don't have an answer for. So I don't know in this case maybe exactly the right answer, because this is, as we've said, a novel virus. We just don't know everything about it yet. But let's see if we can help Laura in Pennsylvania. Here's what she asked. Laura writes, my mom is a teacher in an elementary school and has a compromised immune system due to previous cancer treatment. A mother of one of the students is in quarantine from being in close proximity with someone who has the virus, but they're allowing the child to go to school. Should the child also be quarantined? And is this safe for my mom to go to work?
So the answer, at least for now, and I think it may depend if you have a lot of spread in your community, the Department of Health may suggest otherwise. But for the moment, if somebody is being, now let's just define what quarantine and isolation are. Quarantine is you are not sick, but you've been exposed, and you need to put yourself in quarantine for 2 to 14 days, which is the incubation period. Isolation is if you're actually sick, and then you're in isolation because you don't want to infect other people. If you are an individual living in a home and you yourself are in quarantine because you were exposed, your contacts do not also need to be in quarantine, which means people who live with you are allowed to go out into the environment. The contact of a contact is not considered a risk. Again, if there's a lot of activity within your community of community spread, your Department of Health might say, listen, if one person in your house is quarantined, better to have everyone stay. But for the moment, when I spoke to our epidemiologist as of at least last week, contacts of contacts don't need to be in quarantine.
So, Sean Morrison, I can't even imagine how many questions you're getting as the director of geriatrics and palliative medicine. I'm going to give you something specific from this 74-year-old by the name of JCB, but it's really as part of a larger question that we're hearing a lot about, like, how old is too old? There are a lot of healthy 75 and 80-year-olds. There are people who are maybe not so healthy who are 60. In this case, this person says, I'm 74 with early onset COPD. I've had both the PCV13 shot and then PPSV23 for pneumonia protections, as have many other seniors. Are we protected, somewhat protected, or not? In other words, if I've gotten a shot, if I've gotten a flu shot, am I less likely to get this? What are you saying to the seniors that you deal with?
Right. So the first thing we're saying to seniors is what the question you had was, am I at risk? And the answer to that is, we don't know exactly who is at risk, but we know that those over the age of 60 are at higher risk of having severe illness than those who are under age 60. And right now, we can't tell you exactly who's at higher risk within that group. What we also know is there is no current vaccine for COVID-19. So if you've had the flu shot, if you've had a pneumonia vaccine, even if you had a measles vaccine, that's not going to protect you from this particular virus.
Which brings us perfectly out to the remote, Dr. John Torres. Dr. Torres, you're at the Biosafety Level 3 Vaccine Lab at the University of Pittsburgh Medical Center, where they're literally racing against the clock to create a coronavirus vaccine. Tell us what you're seeing and what you're hearing.
So what we're seeing, we're at the University of Pittsburgh Center for Vaccine Research. This is the same place where Dr. Salk developed and produced the polio vaccine back in the 1950s, and they've done an amazing work here at getting vaccines throughout the decades since. They're specifically working on the coronavirus vaccine right now. They're one of the centers working on it, and it's a race against time, essentially, because now we know it's out of containment. It's more in a mitigation process, and part of that mitigation means getting a vaccine to try and help everybody out. That's what we do with the flu. We can't contain it, so we try to mitigate it. We try to help out as best we can. Now, it's going to take about a year, year and a half, but they're really doing incredible work here to try and get that as short as possible, but it does take some time, and that's one of the things we've learned as we come here. This is a very highly secure lab. Again, they have a lot of different viruses here they're dealing with. Some of those create illnesses, some of those cause death, but it's very specific how you go in there, and they've given us some exclusive access to there to be able to see what they're doing and see how they're working. It's pretty amazing what they're doing.
Hey, Dr. Torres, could I put one of our audience questions to you, actually? Because since you are at this lab that's doing this research, it gets to one of the questions in terms of the intensity with which we're dealing with coronavirus. One of our viewers asked, if flu results in over 50,000 deaths a year in the U.S. alone, why is so much commotion being created with coronavirus, where deaths are significantly lower than the normal flu?
And I thought Dr. Fauci said it appropriately the other day when he said, here's the deal, flu, the mortality rate, the fatality rate of flu is about 0.1%. This one looks around 1%, so it's 10 times higher. It hasn't spread quite as much throughout the world as the flu typically does, but it's only been around for a couple of months. You can imagine if we didn't do anything about it and it had 10 times the fatality rate, it could cause a lot more issues. But that's why they're putting so much effort around the world and in the U.S. as well to try and keep it under control. It's gotten through that containment. We're trying to mitigate now. But the important part is to keep making that effort, because if we don't, it could actually prove deadlier than the flu as far as numbers are concerned. We know it's already deadlier than the flu as far as the amount of fatality, the rate of fatality. We're trying to keep those overall numbers as low as we can, though.
One of the big questions, and I want to open this up to the panel, you all have your unique experiences, but it's all about being tested, right? Should I be tested? Can I be tested? A lot was written after Tom Hanks and Rita Wilson said that they were positive, that they got tested just like that in Australia, something that some people have said they might not have been able to do. I know friends of mine who are doctors are talking about the struggles that they're still having with deciding which patients can be tested, what to do with some of those patients if they can't test them and they're still a little nervous about them. Where are we with this? Because there are other countries like Australia where they apparently have no shortage of tests.
You should answer that just based on your current experience.
Listen, I just tried to get a patient tested an hour ago, and I couldn't in my outpatient office.
In your opinion, that person should have been tested?
I would have liked to test her. I shouldn't have even said her, but it's one of those things where was my clinical suspicion the highest it's ever been? No. Was it way down here? No. The message that we got from the only place that we're currently doing it is the emergency department, and they don't have enough. They said we can only do it if the patient is sick enough to require hospitalization. And I was dumbfounded. I've been covering this story for weeks now, and I'm sure we all are getting very mixed signals. Oh, LabCorp is testing, and millions of tests are getting rolled out. And that's all fine and good until I finally was in my office today. I thought, I can't get my patient tested. And I really would have liked to.
Well, we have so much more.
There's that.
So much more to talk about. Our experts are going to stick around, and throughout the hour, our team is going to keep answering your questions. You can continue to send them our way. Tweet the question with the hashtag MSNBC Answers or email it to talk@msnbc.com. Welcome back to MSNBC special coverage of the coronavirus. As the number of infections in the U.S. rises, there are sobering statistics about elderly patients. You are far more likely to die from coronavirus if you're over 80. And the World Health Organization says that in China, the death rate for patients over 80 is 22%. And while deaths of children are very, very rare, the anxiety for kids is very real.
And that is why we're answering your questions right now about how to talk to your kids about the virus and how to protect loved ones who may be more at risk. Joining us now is our expert panel. We're still joined by NBC News medical contributor Dr. Natalie Azar. Joining us on the panel now is the director of the Barnard Center for Toddler Development, Tova Klein, and the chair of the Brookdale Department of Geriatrics and Palliative Medicine at Mount Sinai, Sean Morrison. Glad to have you all with us.
Tova, there was a very simple, straightforward question that I really am curious what you're hearing. It was simply, how will this affect our children and grandchildren? What do you know?
It's a great question. Anxiety is high, and children absorb every bit of adult anxiety. So will it make them anxious? Will it make them clingier, whinier if they're young, or just generally anxious? Yes, for many, many children. And it's really the adult's role to say to ourselves, how can I reassure my children they're okay and we're okay? Because children need more than anything to know that those adults are taking care of them.
So what do you say? People are searching for what to say. I mean, obviously you know your own child and you know what your child's sort of limits are, but what's the general guidelines that you give folks?
So the general guidelines is to think about the age of the child. Younger children you say less to, but they still need reassurance, so simple messages. And really talking about the words that they're hearing. So children are hearing coronavirus, COVID-19, quarantine. They don't know what it is. They're seeing people with masks. We need to talk to them and say, this is a word. Virus is a big word for something like cold or the flu. And lots of people are getting it, but children aren't hurt. And really, parents, as long as those parents are okay, we're not hurt. But we have to be sure that other people don't get it. So that's why your school is closed. Or that's why we see people with masks. So the children don't have to feel like, uh-oh, did I do something wrong, which is what young children feel. Or what's going on and no one's talking to me about it. So simple explanations. And for the slightly older children and teenagers, looking online at some of the information about viruses, I mean, it can be very interesting to them. And for all children, reassuring them, adults, our scientists are doing the work, doctors and nurses are doing the work, the mayor is trying to make the city safe. So lots of messages about the adults really are doing everything they can.
The questions can get really intense really quickly, though. I mean, what do you do if a kid asks you, is grandma going to die?
Right. So these are really important questions because we're telling everybody, it's the older people that we're worried about, and we are. And many children live with grandparents or are taken care of by grandparents. And so, again, we need to give them some reassurance. You know, we're not visiting grandma and grandpa right now. Our job is to make sure that we don't spread it to them. And if grandma and grandpa don't get the coronavirus, they'll be okay. And if they do get it, they'll go to the hospital and the doctors will take care of them because it is scary for children.
So one of our producers actually wrote in, we recognized your name, Anthony.
That's not why he's at the top of the list, by the way. He's just in the mix.
We have an indoor pool party for our 7-year-old's birthday this weekend, followed by pizza and cake. Should we cancel it?
I knew you were going to give me a ringer.
And how do you talk to your kids? So one of the folks here, her daughter loves sports. She's a teenager. She lives for sports. A big tournament she'd been working toward and really wanted to go to just got canceled.
Right.
How do you deal with, first of all, just the decision-making, but also what's inevitably going to be disappointment?
A huge disappointment. We at You know, the colleges are going to online learning, so our seniors are going home suddenly, right? And it's their last term. So all of these are disappointments for children. So to recognize that this is really big and it's not something that the adults wanted or are doing without giving it a lot of thought, but right now everybody's trying to control this virus so that more people don't get hurt. And you have to address their feelings, a feeling of disappointment, of anger. It makes you angry if you can't do this. And for a 7-year-old, I would say if it's 2 or 3 children, the doctors probably will tell you it might be okay, but if it's a big party, to say this is a really, really unusual time and it's not your fault, honey, but right now we can't have the party, but we'll do something else fun, and hopefully we'll get to it soon, a delayed party.
Let's talk about seniors and the elderly now. Let's start with a question from Leslie. Leslie asked, in 6 days, I will be president of our condo association in Naples, Florida.
Timing is everything.
Absolutely. Southwest Florida. We have 473 units primarily owned by people over 60. Many are seasonal rentals of 1 to 3 months. We have many dinners and other social events with 100 to 120 people close together eating, dancing, etc. My question is that now that there are virus victims in our county, should we begin to plan to shut down the clubhouse and or take other actions to keep our aged population safe? Worth noting, since we're talking about Florida, that there were earlier cases that were noted in the Tampa Bay area. There's also some concern about, on the other coast of Florida, about Bike Week in Daytona Beach, which is happening right now. And we got a comment from someone who was very upset, saying that this big public event is going on and the county doesn't seem eager to shut down Bike Week. As a Harley rider, I can empathize, but I also empathize with this writer in Naples.
Yeah, how do they make that decision?
So the answer is, first off, yes and. So first of all, for all older adults, what we're recommending is what everybody should be doing, which is wash your hands frequently, don't touch your face, disinfect often. And then for that group at higher risk, those over the age of 60, there are a couple of other additional things that we're recommending. One is stay out of big crowds. And for us...
So in her case, is an event of 100 and 120 together eating, dancing, a big crowd?
Cancel. Absolutely.
Okay.
We are recommending that people don't go out unless they have to. Stay at home and limit the number of visitors that you have. Avoid public transportation unless you absolutely have to. And if you have to ride the trains or you have to ride the buses, pick one that's not crowded. Pick a car that is not crowded. It's not the time to be going to the movies. It's not the time to be going to theater. It's the time to stay home and stream.
This question is fascinating. I would like to know what my elderly family member can do to naturally strengthen their immune system. Can they?
It's a very, very complicated question to answer in a very short period of time. The answer...
You can't pop a pill, I'm guessing.
You can't pop a pill.
Yeah,
you can't pop a pill. I know what you want is the magic bullet that says, I can do this now.
Well, and then it also depends on what we mean by strengthen.
Yeah.
I mean, eating right and exercising will strengthen your immune system. But if you go into a part of the world where there's anthrax, like, that's not going to save you.
You know, the simple things, what is strengthening your immune system? Exercise, diet, rest. But is there a magic pill or something you can do right now that's going to make things better and strengthen your immune system? The answer is, unfortunately, there isn't.
Does this affect the conversation about palliative care as well? I mean, at a certain point, there are a number of different decision gates in which the loved ones of an elderly family member need to think about things like palliative care, hospice care. Like, this feels almost like in certain situations this could fold into that as well.
So palliative care is a specialty that's focused on caring for people with serious illness, and it's provided at the same time as all other appropriate medical treatments, so that for anybody in the hospital, somebody with COVID-19 associated illness or any other serious illness, the goal of palliative care is to provide the added layer of support so that people feel well, their quality of life is as best as it can be, and they're cared for appropriately in the hospital. So yes, if somebody is seriously ill and has COVID-19 associated illness that is putting them in that state, then yes, palliative care with all other appropriate treatments is absolutely appropriate.
Dr. Natalie Azar, Tova Klein, Sean Morrison, thanks to all of you. Great conversation again.
All right, coming up today marks 1 month since the Dow hit its all-time high of 29,551.
Just a month ago.
A month ago today, but now a month later, today, we are also in a bear market as coronavirus fears continue to drive the major indices down. But those fears go way beyond Wall Street. What does it all mean for you and for your money?
But first, what is it like to be infected with coronavirus? What are the signs, really, that you might have it? We're going to talk to a woman who tested positive after attending a house party next. But let's go now to Joe Biden, who's going to be giving an address about this very topic, coronavirus. Let's listen.
Across the nation, many of us are feeling anxious about the spread of the COVID-19, known as the coronavirus. And the threat it poses to our health, our loved ones, our families, our livelihoods. You know, I know people are worried. My thoughts are with those who are directly fighting this virus. Those infected, families that have suffered a loss, first responders and healthcare providers who are putting themselves on the line as I speak for others. I'd like to thank those who are already making sacrifices to protect us, whether that's self-quarantining themselves or canceling events or closing campuses. Because whether or not you're affected or know someone who is infected or have been in contact with an infected person, this is going to require a national response, not just from our elected leaders or our public health officials, but from all of us. We must, all of us, follow the guidelines of the health officials and take appropriate protections to protect ourselves and critically to protect others, especially those who are most at risk for this disease. It's going to mean making some radical changes in our personal behaviors. More frequent and more thorough hand washing, staying home from work if you're ill, but also altering the deeply ingrained habits in our country like handshakes and hugs, avoiding large public gatherings. That's why earlier this week, on the recommendation of officials, my campaign canceled election night rallies that we had planned to hold in Cleveland, Ohio. We're also reimagining the format for large crowd events we had planned in Chicago and Miami in the coming days. And it will continue to assess and adjust how we conduct our campaign as we move forward and find new ways to share our message with the public while putting health and safety of the American people first, above everything else. Yesterday, we announced a Public Health Advisory Committee of experts who will continue to counsel my campaign and me, help guide our decisions on the steps to minimize further risks. But we will lead by science. The World Health Organization now has officially declared COVID-19 a pandemic. Downplaying it, being overly dismissive, or spreading misinformation is only going to hurt us and further advantage the spread of the disease. But neither should we panic or fall back on xenophobia. Labeling COVID-19 a foreign virus does not displace accountability for the misjudgments that have been taken thus far by the Trump administration. Let me be crystal clear. The coronavirus does not have a political affiliation. It will infect Republicans, independents, and Democrats alike. It will not discriminate based on national origin, race, gender, or zip code. It will touch people in positions of power as well as the most vulnerable in our society. And it will not stop. Banning all travel from Europe or any other part of the world may slow it, but as we've seen, it will not stop it. And travel restrictions based on favoritism and politics rather than risk will be counterproductive. This disease could impact every nation and any person on the planet. We need a plan about how we're going to aggressively manage here at home. You know, you all do know the American people have the capacity to meet this moment. We're going to face this with the same spirit that has guided us through previous crises. And we'll come together as a nation. We'll look out for one another and do our part as citizens. We have to harness the ingenuity of our scientists and the resourcefulness of our people. And we have to help the world to drive coordinated global strategy. not shut ourselves off from the world. Protecting the health and safety of the American people is the most important job of any president. And unfortunately, this virus laid bare the severe shortcomings of the current administration. Public fears are being compounded by pervasive lack of trust in this president, fueled by adversarial relationships with the truth that he continues to have. Our government's ability to respond effectively has been undermined by hollowing out our agencies and disparagement of science. And our ability to drive a global response is dramatically undercut by the damage Trump has done to our credibility and our relationships around the world. We have to get to work immediately to dig ourselves out of this hole. And that's why today I'm releasing a plan to combat and overcome the coronavirus. The full details of the plan, you want to see them, go to joebiden.com, where I lay out the immediate steps we have to take to deliver one decisive public health response to curb the spread of the disease and to provide treatment to those who need it, and a decisive economic response that delivers real relief to American workers, families, and small businesses, and protects the economy as a whole. I offer it as a roadmap, not for what I will do as president 10 months from now, but for the leadership that I believe is needed and required at this very moment. President Trump is welcome to adopt all of it today. The core principle is simple. Public health professionals must be the ones making our public health decisions and communicating with the American people. Public health professionals. It would be a step toward reclaiming public trust and confidence in the United States government as well, toward stopping the fear and chaos that can overtake communities faster than this pandemic can overtake them. And it's critical to mounting an effective national response that will save lives, protect our frontline health workers, slow the spread of the virus. First, anyone who needs to be tested based on medical guidance should be tested at no charge. At no charge. The administration's failure on testing is colossal, and it's a failure of planning, leadership, and execution. The White House should measure and report each day, each and every day, how many tests have been ordered, how many tests have been completed, and how many have tested positive. By next week, the number of tests should be in the millions, not the thousands. We should make every person in a nursing home available for testing. Every senior center or vulnerable population has to have easy access to the test. And we should establish hundreds of mobile testing sites, at least 10 per state, and drive-through testing centers to speed testing and protect the health of our workers. The CDC, private labs, universities, and manufacturers should be working lockstep to get this done and get it done correctly. No effort should be spared, none. No excuses should be made. Tests should be available to all who need them. And the government should stop at nothing to make that happen. We must know the true extent of this outbreak so we can map it, trace it, and contain it. Nor should we hide the true number of infections in hope of protecting political interest or the stock market. The markets will respond to strong, steady, and capable leadership that addresses the root of the problem, not efforts to cover it up. Secondly, we need to surge our capacity to both prevent and treat the coronavirus and prepare our hospitals to deal with this influx of those needing care, as I've been saying for weeks. This means not just getting out the testing kits and processing them quickly, but making sure communities have the hospital beds available, the staff, the medical supplies, the personal protective equipment necessary to treat the patients. The President should order FEMA to prepare the capacity with local authorities to establish temporary hospitals with hundreds of beds in short notice. The Department of Defense should be planning now, should have been planning, to prepare for the potential deployment of the resources provided, medical facility capacity and logistic support that only they can do. And a week from now, a month from now, we can need an instant 500-bed hospital to isolate and treat patients in any city in this country. We can do that, but we are not ready yet, and the clock is ticking. As we take these steps, state, federal, and local authorities need to ensure that there's accurate, up-to-date information available to every American citizen, to everyone, so everyone can make an informed decision about when to get tested, when to self-quarantine, when to seek medical treatment. And the federal government should provide states and municipalities with clear guidance about when to trigger more aggressive mitigation policies, such as closing schools. Thirdly, we need to accelerate the development and treatment of a vaccine. Science takes time. And it will still be many months before we have a vaccine that can be proven safe for public use and produced in sufficient quantities to make a difference. But therapeutics can and should come sooner. This will save lives. When I put together and we passed the Cures Act of 2016 to accelerate work on at the National Institute of Health, but now it has to be make available resources to speed that process along. We have to fast-track clinical trials within NIH while closely coordinating with the FDA, the Food and Drug Administration, on trial approvals so that science is not hindered by the bureaucracy. And when a vaccine is ready to go, it should also be made widely available and, again, free of charge. We should also immediately restore the White House National Security Council Directorate for Global Health Security and Biodefense, with a full-time dedicated coordinator to oversee that response. Our administration, our last administration, we created that office to better respond to future global threats after the Ebola crisis of 2014. It was designed for exactly this scenario. But for some reason I still don't understand, President Trump eliminated that office 2 years ago. Look, here's the bottom line. We have to do what's necessary to beat the challenge, beat this challenge sooner rather than later. We will beat it. I assure you, if we wait for it to worsen, then scramble to catch up, the human and economic toll will grow faster, larger, and more dangerous. Congress gave this administration $8 billion last week to fight the virus. We need to know exactly what that money is going to be used for, how quickly it's going out the door, and exactly how it's being spent. This brings me to the second half of the challenge in terms of economic dislocation the coronavirus is going to cause in our country. We must do whatever it takes, spend whatever it takes to deliver for our families and ensure the stability of our economy, taking immediate, bold measures to help Americans who are hurting economically right this minute. It means we'll need bigger and broader measures to shore up the economic demand, protect jobs, keep credit flowing to our job creators, and make sure we have economic firepower we need to weather the storm and get the people and this economy back to full strength as soon as possible. This crisis will hit everyone, but it will hit folks who live paycheck to paycheck the hardest, including working people and seniors. Another tax cut to Google or Goldman or millionaires won't get the job done. Remember, another tax cut to these folks will not get the job done. Indiscriminate corporate tax subsidies won't effectively target those who really need the help now. We need to place our focus on those who are struggling just to get by. People are already losing jobs. We need to replace their wages. That includes workers in the gig economy who lack unemployment insurance. Parents are already struggling with child care costs. We need to give them relief. Children who rely on school lunches, we need to provide food for them. Schools will need to help in ensuring children who don't have easy access to computers can still learn if their schools shut down. People who have difficulty paying their rent or mortgage because they've been laid off or had their hours cut back, we need to help them to stay in their apartments and their homes. Small businesses will be devastated as customers stay home and events are canceled. and we need to make sure they have access to interest-free loans. Not loans with interest, interest-free loans. It's a national disgrace that millions of our fellow citizens don't have a single day of paid sick leave available to them. We need both a permanent plan for paid sick leave and an emergency plan for everyone who needs it due to the outbreak now. Beyond these national measures, my plan also calls for the creation of a state local emergency fund to make sure governors, mayors, and local leaders who are battling the coronavirus on the ground as I speak have the resources necessary to meet this crisis head on now. These funds can be used at the discretion of local leaders for whatever they need most, from expanding critical health infrastructure, hiring additional health care and emergency service personnel, or cushioning the wider economic blows this virus is going to create in their communities. We need smart, bold, compassionate leadership that's going to help contain the crisis, reduce the hardship to our people, and help our economy rebound. Let me be very clear. Unfortunately, this will just be a start. We must prepare now to take further decisive action, including relief that will be large in scale, focused on broader health and stability of our economy. Look, we can only protect the health of our economy if we do everything in our power to protect the health of our people. The last point I want to make is this. We'll never fully solve this problem if we're unwilling to look beyond our own borders and engage fully with the rest of the world. A disease that starts any place on the planet can get on a plane to any city on Earth within a few hours. We have to confront the coronavirus everywhere. We should be leading a coordinated global response, just as we did to the Ebola crisis, that draws on the incredible capability of the U.S. Agency for International Development and our State Department to assist vulnerable nations in detecting and treating the coronavirus wherever it's spreading. We should be investing in rebuilding and strengthening the global health security agenda, which we launched during our administration, specifically to mobilize the world against the threats of new infectious diseases. Look, it can be hard to see the concrete value of this work when everything seems to be going well in the world. But by cutting our investment in global health, this administration has left us woefully unprepared for the exact crisis we now face. No president can promise to prevent future outbreaks. But I can promise you this. When I'm president, we will be better prepared, respond better, and recover better. We'll lead with science. We'll listen to the experts. We'll heed their advice. And we'll build American leadership and rebuild it to rally the world to meet global threats that we're likely to face again. You know, and I'll always tell you the truth. This is the responsibility of a president. That's what is owed to the American people. Now, in the difficult days ahead, I know that this country will summon the spirit, the empathy, the decency, and the unity needed. Because in times of crisis, the American people always stand as one if told the truth. Volunteers raise their hands to help. Neighbors look out for neighbors. Businesses take care of their workers. So we'll meet this challenge together. I'm confident of it. But we have to move, and move now. Thank you all for taking the time to be here, and God bless our troops. Thank you.
A presidential backdrop for a man who would be president, Joe Biden, speaking from Wilmington about what he would do in terms of dealing with coronavirus and the steps that his campaign is also taking. He says that he is rethinking his rallies in Miami and Chicago and will be consulting with experts to determine what his campaign should do next. Also talked about some of the things that he would like to see happen, including spending, as he put it, what whatever it takes to help struggling Americans, to protect jobs and to keep credit flowing. And he said that the research and drug approvals for the NIH should be fast-tracked, and said help should be made widely available free of charge. Joe Biden speaking today in an address that we knew was meant to try to paint a picture of how he would handle a crisis. Definitely one of the topics that will come up when he and Senator Bernie Sanders debate in Arizona this Sunday.
Yeah, and to provide a contrast to what we saw last night from the president, we should say that Senator Sanders is actually going to deliver his own remarks from Burlington, Vermont. That's happening just a little more than an hour from now at 3 o'clock Eastern time. In the meantime, we want to continue our special coverage, answering your questions about the coronavirus outbreak. A couple of things happened just while Joe Biden was talking. In Washington, the U.S. Senate decided not to take its scheduled recess next week. Senate Majority Leader Mitch McConnell says he wants talks to continue on combating coronavirus, and the NHL, following in the footsteps of other professional sports leagues, has decided to pause its season.
Also, the Democratic National Committee is moving the location of Sunday's Democratic debate from Arizona to Washington, D.C. The idea is to reduce cross-country travel. One of the debate moderators has stepped down after he was possibly exposed to coronavirus.
It's a question, actually, I'm sure that he's asking, that millions of Americans are asking right now. How do I know if I've been exposed? Joining us is Elizabeth Schneider, who is now recovering from coronavirus. Thank you so much for being with us. First obvious question, how are you?
Hi, yeah, I'm glad to be here talking with you. I mean, as you can see, I'm happy, I'm healthy, I am recovered, I am feeling very much better. I do feel a little bit tired, just similar to how you feel after you've just gotten over a cold or the flu.
You say that you're feeling much better, which is a great thing.
Yeah.
How had you been feeling? Like, what was it like at the worst of it for you?
Yeah, well, I would say the worst of it was the very first night that I fell sick, which was over 2 weeks ago on Tuesday, February 25th. Initially, I just felt feverish. I had body aches. I had a headache. I just had a general feeling of being unwell. I went to bed and I took a nap, and when I woke up and before I went to bed later that evening, I had a temperature of 103 degrees, which in my recent adult life was the highest temperature fever that I've had. And at that point, I was shivering uncontrollably. So at that point, I knew that I was definitely sick, and I was a little bit worried at that point, to the point where I ended up calling a friend before I went to bed to ask if she could take me to the ER in the middle of the night in case things got worse.
And is that what happened? You went to the ER. Tell us how you were diagnosed and what that process was like for you.
Yeah, I'd be happy to share that with everyone. So I actually did not go to the ER that night, and I did not go to the doctor at all. So I actually did not suspect at all that I had COVID-19, the coronavirus, mainly because I didn't have any respiratory symptoms. I had no cough, no shortness of breath, no tightness in my chest, which recently have been the hallmarks of the disease. And I was getting better. So the next morning, after I spiked that 103-degree fever, my temperature went down to 101. I took extra strength Excedrin, Sudafed, a lot of water, a lot of rest, and I started feeling better. I actually just thought that I had gotten a really nasty strain of the flu that was different from the strain that was included in my flu vaccination that I get every year. So ultimately, how I found out that I tested positive for COVID-19 is that actually myself and a group of friends who all got sick at the same time, in fact, the same exact day, after 3 days where we had been to a house party, we all started to talk amongst ourselves and wonder what we had. Several of those friends went to the doctor and they were refused coronavirus tests because they also didn't have a cough. So we enrolled in a research study, the Seattle flu study that's been going on here in Seattle, not to test for coronavirus per se. They started testing for different strains of the flu. But in the last couple of weeks, due to the public health emergency, especially emerging here in the Seattle area, they started testing for COVID-19. So I submitted a nasal swab sample, and then this past Saturday, I got a call from the research coordinator saying my sample had tested positive.
Well, Elizabeth, that's a good place, I think, to bring in our panel, especially the fact that you said that you were tested by a research panel. Who knows what might have happened if you had to rely on the public health system as it stands right now.
Can I also say you look fantastic, and I'm sorry you had to go through this. It must have been scary at the time, but we do have with us Dr. Natalie Azar still here, Joseph Fair is still here. Also with us is Yasha Munk, who is an associate professor at Johns Hopkins University. Marcia Santini is a registered nurse at the University of California in Los Angeles. Let me just ask our panelists here, is there a lesson in what you've just heard for people out there who are indeed wondering, could it be me?
I think that what we've been saying for the last few weeks is that, 80% of people will have a mild to moderate illness that can closely resemble a very bad cold or a flu is pretty much exactly what happened. I also think it points to the fact that when we give percentages and we tell people what the symptoms are and we say, fever and cough or shortness of breath and achiness, that not 100% of people have 100% of the symptoms. So you have to have a high index of suspicion. And early on, it required a travel history. Now, of course, it's obviously more difficult as it's more spread.
Professor Munk, one of our audience members, asked the kind of obvious question. Joe Biden got to it a bit in his remarks that he just gave from Wilmington, asking quite simply, are our hospitals ready with beds, staff, and equipment for this pandemic, especially in heavily populated areas like where Elizabeth lives, where she, fortunately, was near a research study and couldn't go to a hospital that had the tests?
Well, I think it's too early to tell whether or not the hospitals are ready. What we're seeing in countries from China to Italy is that the spread of this disease is exponential. So it's possible to have 100 cases today, 1,000 cases a week from now, and 10,000 cases 2 weeks from now. And as these cases spread, you have people coming into intensive care with very, very serious symptoms, very serious respiratory failure. Not in every case, as we've just luckily seen, but in a significant number of cases. And what we're seeing in Italy in these days is a lot of hospitals no longer having the capacity to treat all of the patients, no longer having the medical staff, and most importantly, no longer having the intubators that they need in order to ensure that people can survive. So I think the first priority right now is social distancing, to make sure that we stop the spread of this disease by staying at home, by canceling all of these events. But the second, and Vice President Joe Biden has said this very well, is to increase the capacity of ICUs on an extraordinary basis. And I very much hope that the government, the administration, heeds Joe Biden's recommendations in that respect.
And Marcia, you obviously have been on the front lines of this, as nurses often are. So what is the one thing that you would like to get out there? What do you want people to know based on your experience?
Well, what I'd like people to know is that we need to do everything we can to protect our healthcare workers. And how can we do that? Each one of us has to take a part in this fight. People need to socially isolate, like we've been saying over and over. You need to stay home. We don't have the testing capabilities, and we cannot overwhelm our healthcare system. Our healthcare system's not designed to handle a mass pandemic. We know often we operate at 100%. So to take in an influx of very sick patients is going to collapse the system. So we need to do everything we can to slow the progression of this disease and not get sick all at once. They talk about the curve. We need to flatten that curve. And hospitals need to protect their nurses. We need equipment. We need the highest protective gear. If we get sick, everybody gets sick.
I know we're low on time. Oh, I'm sorry. I hate to cut you short, but I know we're low on time, and I did want to ask, because there are so many more questions we wanted to get to. What are the top questions that you have right now? We're going to do this again tomorrow. What's the #1 question you'd like answered right now?
I want to know when I can start testing patients I think need to be tested.
Just same question. We have to know the specifics on the tests, where to get them, where you can go now. We just heard from a recovering patient. That's exactly the kind of audience we're trying to reach. When people accuse us of fear-mongering, she may have, traveled because she had no idea, and most people won't have any idea because they are going to have that mild to moderate symptoms, but you still are infectious to others that are in the high-risk category. So that's why we keep emphasizing that if you have any kind of symptoms that could be related to this, we need to social distance.
Joseph Fair, Dr. Natalie Azar, you guys have been fantastic to be with us for the full hour. Elizabeth Schneider, again, glad you're well. So happy you're with us. Jonas, Yasha Munk, Marcia Santini. Kudos to all of our nurses and all of the medical professionals on the front lines. Important messages for them.
And we'll definitely take more of your questions and stories tomorrow, so keep them coming. Use the hashtag MSNBC Answers or email us, talk@msnbc.com. Please do include your name and your city. But until we meet again, thank you so much for spending this hour with us.
Katie Tur will pick up our coverage after this break.